Well, hi, Mom. Once again, I just wanted to congratulate you on your new bundle of joy. I just want to go over some information about umbilical cord care for your little newborn before you take them home. If you have a second, let's just go over this quickly, okay? I have a pamphlet I'm going to be leaving with you. And first of all, I just want to talk about the umbilical cord. During pregnancy, as we talked about earlier, the cord is the baby's connection to the mother. And after birth, the cord is cut and the stump remains connected to the body. This is where the navel and the belly button is, right there. You'll be taught some sample steps for cord and stump taking when you're taking your baby home. But although there are a few things to watch out for, there can be problems with the umbilical cord and stumps, but they are rare, and it usually falls off within a few weeks all by itself. So first of all, we went over this earlier, and you can see there's what your baby looked like in the womb, and it's connected to the umbilical cord. So what we talked about earlier is while your baby was in the womb, he was connected to you by the placenta and the umbilical cord. And the umbilical cord is basically the fetus's life support system. During pregnancy, it contains blood and vessel to provide oxygen and nutrition. During the first few weeks after birth, the umbilical cord stump gradually dries and heals, and then it'll fall off on its own, usually within a few weeks. But during this time, there are some simple care that's needed to keep the cord clean and dry. And you should just be alert and aware of any problems that may arise. You're going to want to keep the cord clean and dry, and look out for any signs of infection or bleeding. However, these other complications are very uncommon, but if any problems do occur, if the stump hasn't fallen off within 4 weeks, please feel free to give us a call. So what does the cord look like? So right here, we can see immediately after birth, the doctor clamped the cord to prevent bleeding, and then the doctor examines the cord and the placenta to make sure that they are normal. In a few days, as you can see here, the stump begins to dry out and it becomes darker. For the first few weeks, simple care is needed, and you need to keep the cord and the stump dry and clean. You should sponge bathe your baby rather than placing him in a tub so it doesn't get saturated and wet. Another thing is the cord gradually becomes dry and black, and it'll fall off on its own, usually between 5 to 15 days. Let the cord dry naturally and do not try to pull it off by itself. The area around your baby's new belly button will be a little red at first, but it should begin to look like new normal skin. So, a couple questions. How should I care for the umbilical cord stump? And that's a very familiar question that a lot of new moms have. And first of all, what you want to do is you want to always wash your hands before touching your baby, and especially before any kind of care. Avoid touching whenever possible. Keep the cord stump clean and dry until it falls off, and don't ever try to pull it off forcefully. Just use warm water to clean around the area of the cord and the stump with every diaper change is recommended. So just pull the stump up gently and clean underneath there, and to clean around the base. Make sure the stump dries after bathing. Also, make sure it'll heal much faster. As you can see, we have the diaper kind of folded down, so you want to expose it to air as much as possible. So just fold down away from the umbilical cord stump when changing your baby. So when should you call the doctor? Which is a very it's a very common question that new moms have. So umbilical cord problems are not uncommon, but it's very important to watch out for signs of infections and other problems. So just call our office immediately if you do have any of the following occurs. If there's redness beyond the area immediately following the base of the cord or stump, if there's active bleeding, more than a drop or two of blood from the cord stump, and if you notice any sticky liquid or any drainage for several days after the stump has fallen off, if your baby's belly button area gets red or hot or discolored or swollen. And also you want to check and see if there's a very foul odor. That can be a sign of infection. So you want to go ahead and give our office a call. So I'm going to leave this, I'll be leaving this pamphlet with you. And there's a couple other areas that you might want to look out for. There's a thing called umbilical granuloma. Sometimes instead of completely drying, the cord will fall and form a granuloma, or a small red mass scar tissue that stays on the belly button after the umbilical cord has fallen off. This granuloma will drain light yellowish fluid, and the condition will usually go away in about a week, but if not, your pediatrician may need to cauterize it off, the granuloma tissue. And also, if your baby's umbilical cord area seems to push outward when she cries, it could be an umbilical hernia. And this is common. It's a small hole in the muscular part of the abdominal wall that allows the tissue to bulge out when there is an increase of abdominal pressure, such as when they're crying. So this is not a serious condition. It usually heals by itself within the first 12 to 18 months. But if you do have any questions, please don't hesitate to reach out to our office. Is there anything I can answer for you at this time? Okay, great. Once again, enjoy your new baby. It's been a pleasure taking care of you and watching the whole process of you carrying the baby, labor and delivery, and everything. I'm so happy for you, and I'm going to go ahead and get the rest of your discharge papers together so you can get your little bundle of joy home, okay? All right, just stay still, and I'll be right with you in a little bit, okay? Thanks so much. Bye-bye.